You feel it building, that clear pressure, that unmistakable urge. You head to the bathroom thinking this should be quick, sit down, get ready to go, and then nothing. Or maybe not exactly nothing. Maybe a tiny hard piece comes out, just enough to make you think relief is finally starting. But then it stops, and what is left behind is the worst part of all, that heavy, frustrating sensation that something is still there, still stuck, still pressing, still waiting right at the exit. If that has happened to you, let me reassure you of something right away. You are not imagining it, and you are not failing at pooping. In many cases, the stool really is stuck low in the rectum, right near the end, and that is a very different problem from the kind of constipation most people think about. I'm Dr. David Wilson, and in the next few minutes, I'm going to show you why stool gets stuck at the very last moment, why so many standard constipation fixes do not work when this is the real problem, and the one simple trick that can help you poop faster by working with your body instead of fighting against it. And once you understand this, a lot of things will suddenly make sense. Because here is the key point most people never hear. Not all constipation is the same. Some constipation starts high up in the colon. Stool moves too slowly, sits there too long, loses water, becomes dry and firm, and eventually makes its way down after days of discomfort. That is the kind of constipation many people think of first. But there is another kind. The stool has already traveled all the way down. It has already reached the rectum. It is there. It is ready. You can feel it. But when you try to pass it, it does not come out properly. That is not just slow digestion. That is a mechanical problem at the finish line. And when the problem is mechanical, doing more of the wrong thing usually does not help. That is why people strain. That is why they sit there for 15 minutes. That is why they stand up feeling incomplete, irritated, and exhausted. And that is why they often say, I know I have to go, but it just won't come out. So let's talk about why that happens. Think of the rectum as a holding chamber. It is the final section where stool waits before leaving the body. At the lower end of that area, the body uses muscles to maintain control. One of the most important is part of the pelvic floor. Its job during the day is to help keep everything closed until the right moment. That is useful. That is necessary. That is how continence works. But the body has to switch gears when it is time for a bowel movement. The outlet has to relax. The angle has to open. The pelvic floor has to release instead of grip. If that does not happen well, stool reaches the bottom and then meets resistance. It is like a car reaching the parking gate only to find the barrier still halfway down. Now add one more problem. The longer stool sits in the rectum, the drier it tends to become. Water continues to leave it. So what began as a manageable bowel movement can turn into a firmer, harder, drier piece sitting exactly where you do not want it to sit. Right at the exit. And once that happens, most people make the same mistake. They push harder. That sounds logical, but it often backfires. Because when you strain hard, hold your breath, tighten your abdomen, clench your face, and bear down with force, you may actually tighten the pelvic floor more. Instead of opening the passage, you create even more resistance. So now you have a hard stool meeting a tight outlet. That is why the experience can feel so maddening. You know it is there, you know it wants to come out, but the mechanics are wrong, and this is exactly where the simple trick comes in. The trick is not a miracle supplement. It is not some obscure detox. It is not a harsh stimulant that sends your bowels into a panic. It is positioning. More specifically, it is changing your body position in a way that helps straighten the passage and relax the muscles that are supposed to let the stool out. This is the simple trick. Raise your feet so that your knees are higher than your hips. That is it. You can use a small bathroom stool, a squat-style toilet stool, or any stable support that safely lifts your feet a few inches. Then lean your body slightly forward. Let your elbows rest on your thighs if that feels natural. Relax your belly. Do not suck it in. Take a slow breath in, and then breathe out slowly through your mouth as you release rather than force. That sequence may sound almost too simple, but for many people, it changes everything. Here is why. When you sit bolt upright on a modern toilet, the angle between the rectum and the anal canal is not always ideal for easy emptying. Elevating the feet and bringing the knees above the hips can help create a more natural squatting posture, which may help the rectum align more favorably for a bowel movement. Cleveland Clinic specifically notes that raising your feet on a small stool can help stool pass more efficiently by supporting a more natural position for bowel movements. Source: that matters more than most people realize. Because pooping is not just about pressure, it is about alignment. And when alignment improves, the amount of force needed often drops dramatically. Then comes the second half of the trick, and this part is just as important. The breath. Most people hold their breath and bear down, but holding the breath tends to create tension. What you want is release. A slow exhale helps the body soften. A relaxed belly helps reduce unnecessary bracing. And when the pelvic floor is less tense, the stool has a better chance of passing without the battle. So if you remember nothing else, remember this. Feet up, knees above hips, lean forward, belly soft, long, slow exhale. You are not trying to win a contest of force. You are trying to create the right mechanics. Now, if stool has already become very dry and very firm, posture alone may not always be enough. And that is where people often ask about what actually helps in the short term. For occasional constipation, products like magnesium hydroxide are used on a short-term basis, according to Medline Plus, and glycerin suppositories are commonly used as a mild rectal laxative that can soften stool and stimulate the rectum locally. Source. Some glycerin suppositories can work fairly quickly, often within about 15 to 30 minutes, according to NHS formulary guidance. Source. But I want to be careful here. If you have kidney disease, magnesium-containing laxatives may not be appropriate because magnesium can build up in people with impaired kidney function and can cause serious problems. Medline Plus specifically warns that magnesium laxatives can cause serious electrolyte and heart rhythm issues in people with kidney impairment. Source. So if you have kidney problems, heart issues, take multiple medications, or this is becoming a repeated pattern, talk with your own doctor or pharmacist before reaching for over-the-counter products. Because the real win is not just getting unstuck today. The real win is understanding why this keeps happening and preventing it from turning into a weekly struggle. Now let's talk about the common reasons stool gets stuck right at the end. Number 1, not enough fluid. The body needs water to help keep stool soft enough to move. NIDDK notes that drinking water and other liquids helps fiber work better and can help with constipation management. Source number 2, not enough fiber. Fiber helps hold water in the stool and supports more regular bowel movements, but fiber only works well when it is introduced correctly. Number 3, ignoring the urge. This one is huge. If your body tells you it is time to go and you repeatedly delay it because you are busy, traveling, working, or simply not in the mood, stool stays in the rectum longer, and the longer it stays there, the drier it can become. Number 4, medications. Certain medicines are notorious for slowing the bowels. Opioids are a major one. Iron supplements can contribute. Some blood pressure medications can play a role. Some antacids, some antidepressants, and other medications can also change bowel function. Number 5, pelvic floor dysfunction. The American Society of Colon and Rectal Surgeons describes dyssynergic defecation or pelvic outlet dysfunction as a condition in which pelvic floor muscles may fail to relax in a coordinated way during a bowel movement. Source. That means the problem is not always that there is not enough pushing power. Sometimes the problem is that the exit is not relaxing properly. And if that is happening, harder pushing can make the pattern worse. This is one reason some people feel like they have tried everything. More fiber, more water, more coffee, more straining, more time on the toilet, and yet the same problem keeps coming back. Because if the issue is a coordination problem, the body needs a better strategy, not just more effort. Now, here is something else that matters. A lot of people turn every bowel movement into a task. They sit, they scroll, they wait, they try, they force, they stay there for 10 or 20 minutes hoping that eventually something will happen. That is usually not the best approach. When you sit too long and keep straining, you increase pressure in the area. That can aggravate hemorrhoids, irritate the anal canal, and set up a cycle where every future bowel movement feels more tense and more difficult. Your body tends to empty better when you respond to the urge, set up the right posture, breathe, release, and let the mechanics do their work, not when you turn it into a wrestling match. So let's move from the rescue strategy to prevention, because this is where things really change. If you keep the stool softer, better hydrated, and easier to pass, and if you improve the mechanics of how you sit and relax, these episodes often become much less frequent. Start with hydration. You do not need to obsess over a perfect number, but if your urine is constantly dark and your fluid intake is low, your bowels may be paying the price. NIDDK recommends plenty of water and other liquids to help fiber work better. Source. Then look at fiber. This is where I need to correct one of the biggest mistakes people make. People hear that fiber is good, so they suddenly add huge amounts all at once. More bran cereal, more supplements, more seeds, more raw vegetables, more everything, and then they get bloated, gassy, backed up, and uncomfortable. Why? Because fiber needs water, and it often needs a gradual increase. NIDDK advises increasing fiber and fluids together, and guidance on digestive symptoms commonly emphasizes adding fiber slowly to reduce gas and bloating. Source. So do not go from low fiber living to a fiber explosion overnight. Increase it slowly. Give your gut time to adapt. And do it with enough fluid. Now let's talk food. Many people do well with simple choices like kiwi, prunes, oats, beans, chia, ground flax, and cooked vegetables. These are not magic, but they can make stool easier to pass by, supporting softness, bulk, and regularity. Prunes, in particular, are commonly used because they contain fiber and sorbitol, which may help stimulate bowel activity in a gentler way than harsh stimulant laxatives. Medline Plus and major clinical sources broadly support fruit, vegetables, and fiber-rich foods as part of constipation care, and the reference script's overall food logic aligns with that broader dietary guidance. Source. But again, consistency matters more than intensity. A few steady habits beat dramatic rescue attempts almost every time. And maybe the most important habit of all is this: honor the urge. Do not train your body to wait all day. When stool reaches the rectum, the body sends you a signal. Repeatedly ignoring that signal can make the rectum less responsive over time, and the stool that was easy to pass at 8 a.m. may become dry and difficult by noon. That is how people end up saying, "I should have gone earlier." Yes, probably. Now I want to address something else that people rarely talk about honestly: embarrassment. A surprising number of people live with this problem for months or years because they feel silly talking about it. They joke about it. They hide it. They keep trying random remedies. They tell themselves it is not a real issue. But if stool is repeatedly getting stuck at the rectum, that is not just an inconvenience. It affects your day. It affects your mood. It affects your confidence. It makes travel stressful. It makes mornings unpredictable. It makes eating feel complicated. And it can quietly reduce quality of life far more than people admit. So if this is happening to you, do not minimize it, and do not blame yourself. Most of the time, this is not a discipline problem. It is a mechanics problem, a stool consistency problem, a hydration problem, a pelvic floor problem, or a medication problem. And once you identify which one it is, the solution gets much clearer. Now, before we wrap up, I need to be very clear about warning signs. Most constipation is manageable and not dangerous. NIDDK and Mayo Clinic both describe constipation as common, and treatment often starts with diet, fluids, activity, and bowel habits. Source. But there are times when you should not just keep trying home remedies. See a doctor promptly if you have rectal bleeding or blood in the stool, ongoing abdominal pain, unexplained weight loss, a sudden change in bowel habits, or constipation that lasts and interferes with daily life. NIDDK lists bleeding from the rectum, blood in the stool, and continual abdominal pain as reasons to see a doctor. Mayo Clinic notes symptoms lasting longer than 3 weeks, bleeding, or symptoms that disrupt normal activities as reasons for medical evaluation. NICE also flags sudden change in bowel habit, rectal bleeding, weight loss, abdominal pain, and iron deficiency anemia as red flags. Source. Get urgent medical care if you have severe abdominal pain, vomiting, marked abdominal swelling, or cannot pass gas, because those symptoms can suggest something more serious than ordinary constipation. Mayo Clinic patient guidance highlights severe worsening pain, a swollen belly, inability to pass gas, and vomiting as warning signs. Source. And if you keep having repeated episodes where stool feels completely impacted, Medline Plus notes that fecal impaction may require disimpaction and follow-up prevention rather than repeated casual self-treatment. Source. That is not meant to frighten you. It is meant to empower you. Because the right message is not panic. The right message is pay attention. Your body is usually very clear when it needs help. So let's pull this all together. If stool feels stuck right at the exit, the issue may not be ordinary slow constipation. The stool may already be in the rectum, but the outlet may not be relaxing well, the angle may not be favorable, or the stool may have dried out enough to make passage difficult. That is why force alone often fails, and that is why the one simple trick works. Raise your feet so your knees are above your hips. Lean forward slightly, relax your belly, take a slow breath in, then exhale slowly and release instead of strain. That posture change can help create a more natural path for the stool to pass, and it may reduce the amount of force your body feels tempted to use. Cleveland Clinic's bowel health guidance supports foot elevation and a more squat-like posture to help bowel movements move more freely. Source. Then think beyond the moment. Hydrate. Increase fiber gradually. Use food and routine to keep stool softer. Do not ignore the urge. Review medications if needed. And if this is happening often, consider whether pelvic floor dysfunction or another medical issue may be part of the story. Because your body is not trying to torture you. It is not betraying you. It is signaling that the setup is wrong. And when you change the setup, the outcome can change too. I'm Dr. David Wilson, and if you have been stuck in that miserable cycle of pressure, straining, incomplete emptying, and frustration, start with the simple fix first. Feet up, lean forward, belly soft, slow exhale. Let the body open instead of forcing it. For many people, that one change is the missing piece. And once you feel the difference, you will never look at bowel movements the same way again.